I'd like to introduce you to Cathy Rocco, Senior Clinical Education Consultant for ASP, who has been very successful in helping hundreds of ASCs nationwide transition to a higher standard of care.
Thank you, Barbara, and thanks to the audience for joining today. As Barbara mentioned, I've had the opportunity to help hundreds of ASCs nationwide transition to the STERRAD Annex system for their sterilization needs. During today's webinar, I will present sterilization best practices in the ASC setting and will provide a comprehensive overview of the current regulatory guidelines. I will also provide you with the information you need to select the best SS1 alternative for your surgery center. To do that, we will review the key aspects and differences between the STERRAD Annex system and the STERRAD System 1E and how transitioning to the STERRAD Annex system will help you have the best of both worlds. At the end of the webinar, Barbara will take questions sent in by viewers during the registration process. We hope this webinar provides answers and clears up some confusion during this important time by giving you the information you need to select the right alternative for your surgery center. As we begin our discussion of device sterilization, I think it's essential to start by looking at how sterilization is defined. Sterilization describes a process that destroys or eliminates all forms of microbial life, including bacteria, fungi, virus, and bacterial endospores. The FDA and associations such as AORN and APEC define a sterilized device as one that has been processed in a system that delivers a sterility assurance level of 10 to the minus 6, which is 1 in a million chance of a non-sterile occurrence. According to Spaulding's classification, all devices entering a sterile body cavity are defined as critical and require sterilization. Today, we will discuss two choices for processing surgical equipment. We'll walk you through how each works in an effort to help you determine the best choice for your facility. The SS1E provides liquid chemical sterilant processing, also known as just-in-time processing. Devices are processed directly with a liquid chemical sterilant and subsequently rinsed with extensively treated water. After processing, the system is opened and the wet device is removed and exposed to the ambient room environment. This exposure poses a risk for the device to become contaminated due to normal microflora found in non-sterile settings, thus minimizing the benefit of the chemical sterilant process. Additionally, devices must be used immediately after processing or they will run the risk of recontamination. Consequently, the SS1E should not be used on critical devices that must be sterile unless they are heat sensitive and incompatible with sterilization methods such as steam and gas, vapor, plasma, low temperature processes. This translates to having no other sterilization modality available to reprocess the device. On the other hand, the STERRAD Annex system provides terminal sterilization. Before processing, devices are either placed in a closed container system or packaged using sterilization wrap or pouch that allows for sterilant penetration during processing. This means after processing, devices can be used immediately or stored, maintaining sterility. Storage reduces immediate preoperative preparation and increases productivity because devices can be sterilized in advance, helping to minimize common reprocessing cancellations or failures on the day of surgery that are common with just-in-time processing. Terminal sterilization with the STERRAD Annex system allows you to transport the instruments to an operating field without contamination. According to AMI, the use of biological indicators, or BIs, is considered the gold standard in sterility assurance because they provide direct evidence whether or not the sterilization process conditions are sufficient to kill spores to a 10 to the minus 6 sterility assurance level. The STERRAD CycleSure 24 biological indicator is designed specifically for STERRAD systems and has a 24-hour incubation period to keep procedures on track. Now, let's discuss how using the STERRAD Annex system in your surgery center can help you to increase productivity, and improve efficiency. With the dry package terminal sterilization process of the STERRAD Annex system, instruments are ready for use immediately or can be stored for use later. This ensures that your surgery center can start ahead of schedule and stay ahead of schedule, limiting the number of reprocessing cancellations or failures on the day of surgery that are common with just-in-time processing methods like the SS1E. Also, wrapped package systems allow for storage and prevent potential contamination during transport, giving you the sterility assurance you demand for your patients. If you'd like to eliminate wrapping altogether, containers can be an economical option that reduces the volume of waste and packages instruments together for easy processing and efficient delivery. For devices processed in a wet system, if a case is canceled or the devices are not needed immediately, they have to be processed again because sterility cannot be maintained. This duplicate processing incurs additional time and processing costs that can become significant over time. With terminal sterilization, if the device is not used immediately, it can be used at a later point because it is wrapped, providing a barrier to maintain sterility. With the STERRAD Annex system, you can optimize instrument flow by processing instruments in a single container all at once. When the STERRAD Annex system cycle is complete, it is sterile and ready to use right away or at a later date, making work more efficient and giving you a sterile inventory that helps to minimize the risk of not having the instruments you need when you need them due to last-minute reprocessing cycle failures common with just-in-time processing. The materials and lumen claims of the STERRAD Annex system extend even beyond heat and moisture-sensitive devices, allowing you to process entire procedure sets in one cycle, for example, arthroscopy and cystoscopy sets. Streamlining your instrument packaging is easier for your staff and more efficient for your surgery center. Sterilizing your sets in the STERRAD Annex system helps you keep up with a fast-paced procedure schedule, track instrument inventory, and reduce workload. ASP, through its medical device testing program, works with medical device companies to determine which instruments can be processed with the STERRAD systems. There are many devices that are commonly used in ASCs that can now be processed in the STERRAD system, such as arthroscopy sets, cameras and light cords, and more are continuously being added to the list of devices. In fact, ASP's STERRAD system has the most labeling endorsements from medical device manufacturers for low-temperature sterilization. For STERRAD systems, there is an easy-to-use STERRAD sterility guide which shows the devices that fall within cleared claims and is now available for your smartphone. The FDA states that devices not validated for processing in the SS1E should not be processed in SS1E. It is important to remember that not all devices cleared for reprocessing in the SS1 are cleared for reprocessing in the SS1E. Let's move on to talk about how the STERRAD Annex system can help reduce costs in your surgery center based on a number of variables. The STERRAD Annex system provides gentle, low-temperature gas plasma sterilization. Because it does not use harsh chemicals like peracetic acid, paired with its low temperature, it is safe for your instruments and ultimately helps you save money when it comes to instrument repair. These two factors also ensure it is safe for workers. Additionally, you can say goodbye to running just-in-case cycles, given you can now rely on your sterile inventory to be ready for every case. Lastly, with the addition of terminally sterilized devices in your ASC, staff no longer needs to arrive earlier for their shift in order to run a diagnostic cycle. When they arrive for their first case, devices are packaged and ready for use.